Lately, although Chrissy Lampkin insisted that she was not in a rush to get married or prioritize parenting. Life has a way of working itself out, and she has now unexpectedly welcomed her first child. However, the moment that was joyful quickly turned into a nightmare. Chrissy Lampkin shocked everyone by announcing that she is now a mother at 53. People followed her relationship with rapper Jim Jones for years, tracking its highs and lows and igniting endless speculations about marriage and children. Just hours after the news broke, Chrissy's health battle after giving birth was shockingly revealed in an exclusive interview with Dr. Jackie Walters, best known for her role on Married to Medicine. Since then, social media has been inundated with prayers, reactions, and contentious discussions about whether or not this pregnancy was planned, but also what exactly happened, what complications Chrissy faced, and how Jim Jones is handling it. Let's analyze it on reality television. Chrissy Lampkin was, since it was evident that Chrissy Lampkin had never prioritized having children over the years. Her first public appearance was on Love and Hip Hop New York, where she and Jim Jones gave fans a behind-the-scenes look at their unconventional relationship. The internet went into a frenzy when news broke that she was 53 and expecting, leaving many of her followers in shock and some others in awe. Celebrated Chrissy's journey into motherhood. But almost immediately after delivery, her postpartum experience took a sharp turn for the worst. Shortly after Chrissy's delivery was publicized, medical specialists were quick to warn about the risks of getting pregnant later in life. One of the most reputable OBGYNs in the nation, Dr. Jackie Walters, agreed to an exclusive interview to talk about the realities of late advanced gestation. But she was unable to do so because of medical privacy regulations. Provide specifics. But she did say that Chrissy had serious issues that needed immediate medical care. According to Dr. Jackie, Chrissy's body was under a lot of stress throughout the delivery process, which resulted in postpartum difficulties. Chrissy allegedly lost a significant amount of blood after giving birth, which might be fatal if left untreated. This kind of issue is more prevalent in older moms because the uterus becomes less elastic with age, unlike younger moms who are usually discharged within a few days. Jackie confirmed that Chrissy's blood pressure soared to critical levels after birth, raising the risk of heart failure, stroke, or possibly seizures. Since physicians are keeping a careful eye on Chrissy's condition, she has been in the hospital longer than anticipated. Following Dr. Jackie Walters' social media conversation, older women frequently experience more severe postpartum problems because their bodies have a harder time recovering from the stress of pregnancy. I love Chrissy, but when I learned that she was pregnant at 53, I was extremely concerned. I'm praying for her full recovery. While many fans sent prayers and well wishes to Chrissy Lampkin, others questioned whether she had been fully informed about the risks before deciding to have a child at her age. Critics say it's difficult for her at her age, so Jim Jones should be by her side all the time. Chrissy Lampkin might have overextended herself. As one Instagram user noted, "This is truly the greatest choice." She was aware of the dangers of becoming pregnant at 53. I hope she survives. Many people supported Chrissy Lampkin because they thought that women should be allowed to make their own decisions without fear of criticism and that children are a blessing at any age. One supporter even said that women should stop thinking as though their lives are over at the age of 50. One wish her a rapid recovery and would allow her to become a mother if she so desired. Doctors are still keeping a tight eye on Chrissy Lampkin. According to two references, the next 3 weeks will be crucial if her body reacts well to treatment, and her doctors are closely monitoring her recuperation. Chrissy may need more medical attention or a lengthier hospital stay if issues continue, but there's also a chance she could be released soon. It's led to a larger discussion about whether having children later in life is riskier or better. Jim Jones, how are you managing? Jim hasn't made any public remarks, but people close to the pair say he has supported Chrissy during the crisis. However, given his history of commitment issues, Some fans have questioned whether Jim is really stepping up during this trying time. According to an insider, he has supported Chrissy and made sure she has all she needs while she heals. Jim should be doing everything for Chrissy right now, according to a Twitter user. Since she recently gave birth to his child at age 53, Chrissy Lynn's recent position as a many people are celebrating mother. It's obvious that Chrissy is going through a difficult rehabilitation and needs all the love and support she can get, in addition to her personal health difficulties. Even though some people are really worried about her well-being and whether this was the correct decision, her 53-year-old motherhood experience has spurred a larger discussion regarding late-age pregnancies. In light of Chrissy's unexpected pregnancy, fans are eagerly awaiting information in the hopes that she will recover. What do you think at 53? Divergent opinions exist among medical professionals and fans regarding this unexpected development. Some support her choice, arguing that motherhood is a lovely experience that shouldn't be restricted by age and that it's a thing for a woman to have a child as long as she's financially, emotionally, and physically stable. Others worry about the health risks of late pregnancies for both the mother and the child. Unborn child, women over 40 who become pregnant, are at risk for problems like gestational diabetes, high blood pressure, and genetic abnormalities for the fetus. Because of these risks, some women in their 50s should think about adopting a child or using a surrogate to grow their family. But according to Chrissy Lampkin's news, there is a growing trend of women challenging traditional notions of motherhood and demonstrating that age is simply a number when it comes to reaching their goals, like creating a family. Do you believe that having children later in life presents health risks that women should be more conscious of? Or do you believe that motherhood is an age-neutral blessing? Please share your opinions in the space provided below. Always remember to like, share, and subscribe to our channel to stay up to date on Chrissy's journey and breaking celebrity news. We'll keep a close eye on this story and keep you updated. As additional information becomes available, return often for more engaging content.